Want to work as a doctor in the UK? Then you've got to pass the PLAB exam. But what's the right way to prepare? Which books to follow? How is it scored? Let's break it all down, step by step, by Dr. DC online. PLAB stands for the Professional and Linguistic Assessments Board. It's a two-part licensing exam for international medical graduates to work in the UK under the GMC, the General Medical Council. In PLAB you have 180 MCQs and 3 hours, clinical scenarios. And PLAB 2, Objective Structured Clinical Examination, OSCE, with 16 to 18 stations. PLAB 1 tests your clinical knowledge using scenario-based, single best answer questions. It covers topics from real-world UK medicine. Not too much theory, but practical patient management. Top study resources are PLAB Able QBank, most recommended. PLAB 1 1700 MCQs, PDF. Oxford Handbook of Clinical Medicine. Nice guidelines summaries. GMC's PLAB Blueprint. Tips for PLAB. Focus on UK clinical practice, not your home country rules. Use daily timed MCQ sessions. Don't memorize. Understand scenario logic. PLAB 1 uses a method called the Angoff scoring system. It doesn't have a fixed pass mark. It changes slightly with every exam. Details. Panel of experts estimate how many borderline candidates would answer each question correctly. Average of their estimates equals pass mark. Usually around 115 to 125 out of 180 is needed to pass. Here's your ideal 3-month strategy to clear PLAB 1. Sample study plan. Month 1, PLABable, system-wise, plus Oxford Handbook. Month 2, mixed questions plus timed mocks, plus nice guideline reading. Month 3, full mocks, plus revise incorrects plus mental health prep. Extra tips. Use daily Anki flashcards. Revise from your mistakes, not just correct answers. Join our discussion groups on Telegram and Facebook, which we are going to public soon. PLAB 2 Overview plus Strategy. PLAB 2 is practical. It's an OSCE-style clinical exam with 16 to 18 stations that test your ability to communicate, examine, and manage real patients. Key areas: ethics, consent, communication. Breaking bad news, medical history taking, counseling, physical examination. Top resources for PLAB 2, Samson Academy. PLAB 2 Academy Notes, e.g. Aspire, SWAMI, Common Cases, NHS Communication Skills Booklets, YouTube practice roleplays. Practice with friends, or join a PLAB 2 coaching group. How PLAB 2 is scored. Each station is marked by an examiner based on your clinical knowledge, communication skills, professionalism. Scoring. Pass/fail for each station. You need to pass 11 out of 16 to 18 stations, including some critical ones. Common mistakes to avoid. Here's what often causes failure in PLAB 1 and 2. Avoid these at all costs. PLAB 1 mistakes. Memorizing answers without understanding. Ignoring UK-specific guidelines. Not managing time in mocks. PLAB 2 mistakes. Poor communication/eye contact. Jumping to treatment before history. Not using layman's terms for patients. Here is my final message. The PLAB exam isn't impossible. With the right guidance, resources, and mindset, you can absolutely clear it on your first attempt.
We're happy to announce that we're launching free live classes for PLAB and USMLE students. Subscribe to Dr. DC online and turn on notifications now so you never miss any updates. Also follow us on Instagram and Facebook for daily updates.